Hello, good day to all. Today we are going to discuss about PCOS, and previous videos we have discussed about depression during pregnancy, diet during the pregnancy, and some other videos of stretch marks over the skin. Why this PCOS we are discussing? Now in the modern time, most common problem it is going on with the women and girls. So let's create a mass awareness and education through this YouTube video to rest of the females so that they can prepare and control and come out with this problem. Women with PCOS are generally overweight or obese, but lean and underweight women can also develop these conditions. Despite its name, PCOS doesn't necessarily lead to the development of multiple cysts on either or both ovaries in all patients. Irregular or abnormal menstruation and high androgen levels, which cause masculine kind of features such as excessive hair growth at unwanted places, and are prominent signs of PCOS. Well, a medical history review and through physical conditions and medical treatment or yoga and exercise make you to come out on this problem very simply. Just need a kind of education. That's it. Although PCOS is incurable, certain dietary interventions and treatment strategies can help reduce the intensity and frequency of PCOS symptoms. PCOS is a long-term condition that usually begins at puberty and continues even after menopause. PCOS doesn't mean or render a woman infertile, but it can make conceiving a child difficult and can increase the risk of pregnancy-related complications. Well, in the United States, alone 6% to 12% of females are diagnosed with PCOS during the childbearing years, which translate to approximately 5 million women. The endocrine pathway is characterized by an excess of androgens, which are male sex hormones that are found in both genders. In fact, PCOS is regarded as one of the leading causes of both anovulation and female infertility. A lot of women with PCOS become aware of their conditions only after getting tested for infertility issues. Let's discuss about the symptoms which are found in the PCOS. Well, one of the first symptoms including an erratic menstrual cycle characterized by irregular periods, hirsutism or the growth of excess unwanted hair on the face and body, acne, hair thinning on the scalp, and even sleep apnea, or can be obesity, slowly weight gaining, and the anxiety or depression. These are certain symptoms you can find. PCOS gets its name from the fact that it often leads to the formulation of multiple small fluid-filled cysts in and on the ovaries. Why does one person develop PCOS? The reason behind is, which we have already discussed in the keynotes, high level of androgens. All women secrete a minimal quantity of male hormones, but in a woman with PCOS, the ovaries produce abnormally high levels of androgens. Androgens play a central role in regulating the menstrual cycle and ovulation. The ovarian function is negatively affected when there is an excess of these hormones in the female body. The second reasons for this kind of PCOS problem is high levels of insulin and obesity. Insulin is a peptide hormone that plays a critical role in the regulation of your blood sugar levels and the conversions of food into energy. It is a chemical message that triggers your body's cell to draw out of the glucose from the bloodstream and use it as energy or store in the cells for later use. It gets little disturbed and the person becomes insulin resistant. And the other factors are low-grade inflammation. See, another common characteristic found in many women with PCOS is they suffer from a type of low-grade inflammation that triggers their ovaries to secrete high levels of the male hormones. Over time, this excess of androgens can create the way for heart and blood vessels problems. Genetics is also considered an important factor as PCOS tends to run in families. Question is, how can you tell that you have PCOS? See, the ovaries fail to release an egg regularly, leading to an unstable menstrual cycle. This is one of the reasons. So the second, you can say in the majority of PCOS cases, one or both the ovaries spread benign fluid-filled sacs or cysts. And the third reason is the excessive androgen secretion can lead to a male type of features such as hirsutism or the growth of the extra unwanted hair on the face, chin and other parts of the body, where women typically do not have the hairs. So these are the reasons you can understand that you are facing the PCOS problems. How the doctor is going to understand to not get the mistakes to giving the certain unnecessary medicines? They can go for certain tests like gynecological exam, expect your health care to conduct a physical examination inclusive of a pelvic exam. The pelvic exam helps eliminate other possible causes of your symptoms. Ultrasound, as you know that your doctor may order an ultrasound to get a closer look at your ovaries. This imaging test measures the size of your ovaries and confirms the presence of ovarian cyst and gauges the thickness of the endometrium, the lining of the uterus. All of these are important factors for PCOS diagnosis. One of the next tests is blood test. As PCOS is a hormonal disorder, your doctor may conduct a blood test to check if your androgen levels are above normal as well as other hormonal imbalances. The blood work helps determine if your symptoms are caused by PCOS or problem with other glands such as the thyroid also. So doctor will also order test to evaluate other health kind of markers that are relevant to PCOS such as blood glucose, insulin, cholesterol and triglyceride levels. While apart from the medicines or testing is there, but even though you can do it naturally, reduce the problem which you are facing with PCOS, maintain a healthy weight. PCOS symptoms tend to more pronounced in women who are on the heavier side. Strict weight management are the only way to ensure that your ovaries function normally and produce an optimal level of hormones in the body. Besides helping you attain a healthy hormone balance, losing the excess weight may lower your blood glucose levels and improve the utilization of insulin by your body. And apart from that, you can maintain a diet which is having low glycemic index, GI. So if you are doing some kind of exercise or kind of running and skipping or something, on that time you just take a bowl of fruits, one of the fruit you can take it, and you have to choose the fruits which is very less amount and having high level of GI. So you should take less amount the fruits having high level of glycemic index. So the reading of the sugar and glucose is 0 to 100 is calculating by in the manner of this. So the next thing is that, which always I am saying, is that for PCOS is something that in this area, mostly from the navel, below the navel area and till the reproductive organs areas, in these areas mostly you need a kind of exercise. In yoga, you know about Chakki Chalanasana. If you are having severe back pain, you have to avoid this Chakki Chalanasana. But if you do lightly, it will help to giving some kind of toning of that areas. First thing, and always remember, please remember when you are having the precautions I am talking about during the period time, 5 days of the period time, you have to avoid the postures which are toning to your abdomen areas and reproductive areas also. So please take care. 5 days only breathing practice, no Kapal Bhati, only Anulom Vilom, no Kapal Bhati, no other kind of Chakki Chalanasana, Matsyendrasana and all this. You can do only sitting pranayam and the meditation. Certain yoga postures after the time of passing of the period, you can do it. Ardha Matsyendrasana, you can do it. Ustrasana, you can do it. Chakki Chalanasana, you can do it. And maintaining a good level of diet, including the fiber and the fruits, avoiding all the oily foods, plastic packs and other unnecessary junk foods. It triggers the problem as if it is heredity, and gaining of weight also chances, and that leads to insulin resistance, and it will continuously, if you remain like this, your old age problem due to the obesity will create a certain issues, and infertility problems may lead to you in depression and anxiety. It is the time now, it is high time when you find that in the age of 15 and 16 or might be in 17, might be the girl or might be the mother can see the girl is facing these kind of problems. Mother has to take care and give the precautions and the good lifestyle, and plus yoga postures which is necessary to tone these areas, and which I already mentioned some postures which helps, and pranayama and some kapalbhati kriya also very useful. Now in this note, and certain diet descriptions and something regarding the postures details I have given in description. Please, I hope you like my videos, you would share and you would care when you share to others, and hoping when you subscribe my video I will send new videos and informative things you will get when you subscribe my video. Thank you very much, and hoping for busy doing your yoga exercise regularly, keeping smile, always smile. Thank you very much. Have a nice day.